Good morning, everyone. We're going to go ahead and get started in about a minute. All right, so let's go ahead and jump in. So welcome, everyone. Thanks again for taking out time from your very busy day to be here with us today. I'm not going to cover a whole lot, but we're going to talk about a whole lot. Okay. Um, just a couple of things that I want to launch into. And again, happy pre-Friday. We're almost at the end of the week. Aren't we all happy about that? Not as happy as I am, huh? Okay. I know there's a lot of chatter and everybody's wondering about the request for proposal that is due out. We are still working feverishly on it. Now that we're post our budget hearing, we are spending every moment that we can working on the RFP that is due to come out early January. So we're still on target for that. And we will be posting everywhere we can to let everybody know across the city of Chicago that the RFP is available. And so you will get notification. What normally happens is our commissioner will send out an email to everyone who's currently contracted, so you'll get that. But it will also go out in public notice as we are launching it as well. There's a lot of information that will be in there, as it has to be, because we have both funding sources that will be in the RFP, both federal and state. For anyone who has been in, and I know I went over it before, one of the things that I said we were doing is purposely doing two separate documents, one for birth to 3, and then a second document for 3 to 5, so that you can focus your efforts in writing on exactly what your services and supports will be for those age groups. And so we look forward to finishing it. We look forward to launching it. And then we look forward to seeing what your responses are to those RFPs. And so it's coming, not there yet, but it is on its way. For those of you that are federal funded, there is an updated performance standard. There's a lot of information in there. Some of the focus areas in there really is about making sure that we're looking at compensation and aligning ourselves with our school district. What you see in the performance standard, it says the school district K-12, but because City of Chicago has a fully implemented universal preschool program, our alignment will be with CPS pre-K. I just want to make sure that everybody understands the acknowledgement for us would be with the pre-K system, because we have a fully implemented of our workforce. How many of you still feel the pressure of what would be a mental health crisis in America? Anyone? It's real, right? When we talk to parents, what parents are saying, they're seriously struggling as parents, is trying to figure this out. I know your teachers in classrooms alongside when children are there are feverishly trying to figure this out. And we have to figure it out. What we've got to do is focus in and think about what is it that we can do. And I talked about it before. What do we do when we have staff in our programs that we can visibly see are struggling? Just what I'm telling you right now is I can't physically be what you need me to be to somebody's baby. And so my being in that classroom, you got to have an alternative. Teachers and staff need to understand when they can say to you, I need to tap out for the day. I did it for the first time in my professional career and shocked someone. She called me back. She said, did you say what I thought you said in that meeting? I said, uh-huh, I did. I said, I'm drowning. And I've never said that in my professional career, but I needed you to hear me say that. Not because of everything that's on my plate, but because I live your life every day, worrying about what's going on in classrooms. And when I'm not able to focus my energy on that, because I'm focusing my energy on something else, then it really gets next to me. So I'm human just like the rest of you. But what I'm asking all of us to do is pay attention to what's going on in your environments. I know we are in a crisis regarding teachers. I don't argue about that. But what they are screaming for is for us to see them, to understand what they're going through and how hard this job is. For any of you who've been in this career for longer than 30 years. This is nothing like it used to be. What goes on is nothing like it used to be. And so we can't continue to do what we used to do in today's environment because it is not working for us. It's not working for our industry. It's not working for those that we want to come and be in our classrooms, in our home visiting programs. It's just not working because the stress is real. People who are compassionate and want to do the right thing for children will choose to not be there with you. When you walk and you drive around Chicago, are there any options for employment outside of early learning? But I heard you go, do any of them pay well? So if I've got a degree, I'm what? I'm marketable. But I went to do what? I went to school. I committed myself to this field and I really want to be here with you. But what I'm going through on a daily basis challenges my everything. And I'm having to make the right decision for me and in some cases for my own children. And so we have got to figure that out. And so we are going to start launching into a whole lot more discussion about workforce health, because if we don't, we will be in the worst crises we've ever seen, and you won't be able to get people to come into your classrooms. We can offer and we can do an RFP and we can put this money out there and we can contract with you, but if you can't get teachers, what? And that's our reality. So to level set that discussion, understand we're going to have to dive into some real discussion about our workforce and their health and how we can work together in partnership with you around what kinds of things we need to do. Coming back from COVID, we started talking and we had meetings with our mental health provider, talked to other mental health providers. And what we talked about was wellness plans. How many of you have a current active wellness plan in your agency? How many of your staff know that you have a current active wellness plan in your agency? Because if it's not, if I don't know about it, it doesn't help me, right? Employee assistance programs. How many of you have employee assistance programs where I can call for help? Not enough hands are going up, and that's why I'm asking questions. Because at the end of the day, if we don't approach this as what it is, which is a crisis, we're not going to get beyond it. And so as we're thinking about this, what I need you to think about is what you need. And I'm asking you to think about this. And this is preceding a meeting with you. What kinds of supports do you think your teachers and staff need? What can we do? What might we be able to do to help you get beyond some of this? Bringing a person in and hiring them is only a part of your job. I work for you, but I am human. And if things get too harsh, what am I going to do? I'm going to have to decide what's best for me. I understand, and I get calls from folks where teachers are saying they're leaving today. So what do you do with the babies when the teacher leaves today? Somebody else has to go in there, right? So when we're talking about workforce, I see it workforce. I'm not just talking about your teachers because other individuals are being tapped in when your teachers tap out. How are they doing? And so how do we approach our field and our industry in a way that we're understanding what's going on and what the impacts are will be some of our next work. Any questions about that? Any ideas right now on what we can do in the next 3 weeks? Anybody? That's why we need to meet so that we can start talking it through. The next thing that I put on here is just Q&A. We are just a little bit of time post an election. Just a little bit of time post an election. We are also sitting where we don't have a completely passed budget or federal budget. We have federal dollars wrapped up in a federal budget that has not passed, right? Right now, some of the discussion is wait until the next administration to pass the budget. Everybody hear what I said? We have got to advocate for ourselves and understand what's going on around us, right? And so I know there's a lot of chatter out there and some of it's correct and some of it is not, but don't allow yourself and your agency to be blinded by what's going on around you. What I need everyone to do is keep up with what you're hearing. Ask questions when you have questions about it. Don't buy everything that you hear because everything isn't right. Some of it is just, but some of it is real. Our job in our field and in your job in your organizations is to know what's going on around you that might impact you and your existence. When we think about what's going on, I need us to think about two things. Number one, what can you do today in your community? Your community is different, everybody's is different. And when I say working and making sure that you are keeping up with what's going on. Because if you're not, then things happen, then you were ill prepared. And so I need you to take your time to understand what's going on in America. I'm not trying to politicize anything, just asking to be informed so that we can make informed choices as we move further into 2025. What have anybody heard that's concerning? Q&A, let's open up the window and start talking. Anybody? What concerns do you have about anything that's going on that might impact the work that we do? Yes, I see a hand in the back. Speak up so everybody can hear you. Okay, so in the Lakeview area, what she's saying in Uptown, as far as what's being had about immigration and deportation is an issue. It is an issue for us because we serve families, right? And so saying that, what might happen with some families? What might they choose to do? I'm sorry? Take their kids home and do what? Hide. I'm just going to be honest. It's not the first time that has happened in America, but I want us to be thinking about what the reality is, right? And so parents who fear will protect themselves and their children. And I think we all understand that. Yeah. So if we're just walking and not thinking about what's going on and the impact, then when you see a parent and we see that stress on their face, stop for a moment and find out what's going on, please. Help them make the right decision for themselves and their family. Don't just ignore it. They need you not just in the classrooms. They need you to understand that they have some serious concerns about their ability just to survive and thrive right now. And so that's who we are in early learning. We've never just been about, did you drop off your baby? It's about, are you whole? What do you need help with? How are you doing? And this is a critical time and a crisis for us to be able to do that right now. Recognize that the things that people are hearing are concerning. Nothing's written yet, but hearing about it is enough of a concern for people to be making choices right now. And so what that means for some of you, you would have what? A whole lot of absence and then a whole lot of drops. What happens to your classrooms and your programs then? That's why I'm asking you to start thinking about it. What kinds of conversations can you have? Because parents don't know this about you. Your door is not open for somebody to come in and take somebody's baby. It's not. But do the moms know that? Do I know that this is a safe place for my baby to be? If nobody comes and makes sure that I know that, I am going to activate a plan about me and my child. But if you let me know that this is a possibility, I might still bring my baby because I at least know my baby is getting fed and has a place where they can be safe. You got to open up and say that to your families. You got to talk to your staff and find out what their concerns are. You got to open up, you got to talk, you got to bridge the gap, you got to be there. And I know this is a lot for all of us right now, but this is our reality. What people are hearing is frightening. Nothing is set in stone, nothing is written yet, but enough words are out there that people are living in fear right now. And that's our reality. A fearful mom brings you a fearful baby. Because if I've heard mom and her stress, then where does my stress come from? It comes from home, but it then shows up where? In school. So as much as you're thinking about where we are with what's happening with our children, I need you to start thinking about what they're hearing right now with adult conversations around them. I know I had to stop my daughter. We were talking around my 8-year-old grandson, and he's very vocal. And he started talking about the election as if he had voted. And I got really nervous about what all the child had heard. But at the end of the day, children can hear, right? All closed eyes ain't sleep. And I'm looking at my Game Boy, but I'm listening to y'all over there. You think I'm still playing games? I'm not. I'm listening to what's going on. And children are very perceptive, so they are hearing what's going on. And the children are concerned. The moms are concerned, and they're leaving them with you. So what have we thought about within our organizations about how we're going to address this? Work with your staff, talk to them about what kinds of things you can do in order to bring some of the stress down for them and for your families. Let families know that you're there, that you are support. Many of you are the anchors in communities and have been for so many years. And these folks, they trust you. And they need a trusted friend right now. So that's what we need to be. What other things are you thinking about? Anybody?
Gonna have a job later on.
Yeah, don't talk about that. Yeah, yeah, jobs. Ooh, what are those? Okay.
Are they cutting our funding? What's gonna happen?
And so if you are going home with that, right, then your stress level is up. And how well can you be the responder when someone needs you? That's why taking care of ourselves is just as critical through this process, right? Some of us have been doing this for a long time and probably thought we would have been retired before something like this happened, where I had to think about, what about my job? Am I going to have a job? Am I going to get paid? But we're here. And I think we're here for a reason, to get us through this. And so as we work together, let's all think about what we're hearing. Let's communicate with each other, make sure that we're hearing and acting on the right information, not the wrong information, and that we're working together to get us through this, right? Many people don't understand what it means when we start talking about there's no budget at the federal level. In most cases, without a budget, they will still have, and they do have, a line item that allows them to continue to operate through this process. So it's not like there isn't the flow of money from federal government to state, et cetera, et cetera. It is there, but it's the unknown about the after that people are beginning to hear and stomach and try to figure out what to do. And so if you know that there are some decisions that are being made out there, please connect yourselves to whatever you need to connect yourself with to keep yourselves abreast of what's going on around you so that you can plan. That's what we're going to be doing. That's what we're doing. We all have to do that. And we have to not just sit back and let something happen and just be reactionaries. Everybody agree on that? Any other concerns or questions from anybody? Project 2025. Yes, Project 2025 was written several years ago. And it has a lot of planned activities in that. And if you read through Project 25, you will see a lot of what I'm talking about right now in a document. How many of you are aware of Project 2025? Everybody should raise their hand. Some people put it up even if she said, everybody should understand what Project 2025 is. Again, I'm not politicizing it. Is a document that is real, but everybody needs to understand what's written into Project 2025, right? Because there are some definite actions and activities that are written in there. And if you're understanding what that is saying, then you will better understand some of what you're hearing. Okay. Anyone else? Yes.
Restrictions on
Absolutely. And what it was around the diversity, inclusion, and all the work that's being done. And what does that mean going forward when we're thinking about some of the decisions that are being made around whether or not these are things that we will even be looking forward to or through or having even be a part of our work. Again, we got to keep our eye on it. But let me say this to everybody. Look around this room. We are diverse. That diversity doesn't go away. We include, that inclusion doesn't go away. And so the way you see something written, we don't have to go and say, we don't do that anymore. Why? Because you've been doing it since your existence. And so just sit in that for a minute and understand that's what early learning has always been. Definitely that's what Head Start has always been. We've always been including those who are what? On the outside, on the periphery, those who have not been brought into the table. I have been brought in through these areas of work that we do every day. And so when I hear that, I know that there's going to be some discussion about it. But at the end of the day, what that means is let's sit first who we are and what we do in that we are an inclusive environment. You don't just open up your door and say, I'm only going to serve this one kind of person, right? You don't just say, I'm going to hire this one kind of person. And so that's not who we are. And so we will continue to be that someone can point to where this has been done, and we've been doing it for many years. And that's what we have to voice and vocalize. Whether somebody allows us to put it in print or not, it's our actions that makes the difference. Okay, anyone else? I just want you to be mindful of the children. Children are hearing, children internalize, and children feel. If a child is in an environment where there is absolute fear, that child is fearful. If that child has an opportunity to spend time in a space where somebody's wrapping their arms around them and helping them understand that they too can be loved and are loved, they at least can come down off of that for a little bit. And that's what you do every day. And I just impress upon you, work with your staff. Remind them that this is a real hard time for everyone. And what they do every day is they help our children feel and be children. And that's what our children need to be able to be right now, our children. Still working on that 8-year-old who I think may be a president someday or something, I don't know. But we still need them to be what they are, and they're children. Parents need to be allowed to be parents. And however we help them, we need to help them. Okay? They need to be that, and we need to help them. And we need to help them understand, yes, it's going to feel like you're riding a wave for a little bit, but eventually that wave is going to bring you right back into that sandy beach, and you're going to be able to put your toe in that water and feel that warmth and feel secure again. And that's what we've got to keep saying to people. We're going to get there, but it will take all of us working together in order for us to do that. So are we in agreement that we will work together to get through this? What I'm asking you is to do this. Don't just bury your heads. We, DFSS, are here to support you. We know how hard this is. Raise your hand, send an email, give us a call. When you need to run something by someone, this is what I heard. Please don't just sit there. Let us be that group that will work you through this as we go over the next few months. Any questions? Any other comments or any concerns? All righty. I'm going to let us move on. Sheree? Thanks, everyone.
Good morning. How you doing? That good, huh? Feels like, it's almost Friday. There you go. I love it. Thank you. Right. Who's gonna be sad that it's almost Friday? Not me. My name is Sheree Johnson. I am the manager of program operations and quality. I am also the self-entitled New Arrivals Recruitment and Enrollment Liaison for DFSS Children's Services. My title will change clearly because I have an update regarding new arrivals. So as of the 31st of October, we have approximately 680 children age 0 to 5 in shelter, which is good actually, because who remembers when we had, it was like literally 15,000 children 0 to 5 in shelter. It was a really crazy time. So to hear that we have less than 700 children in the new arrival shelters is pretty good. But as of October, you guys may have heard that the city of Chicago, we're still a welcoming city, but we are transitioning new arrival families into our One System initiative. It's so new, I had to turn and read it again. One System initiative, which just simply means that in the city of Chicago, we already had a homeless population. We already had homeless shelters. But since August of 2022, we started this new initiative for new arrival families. So as of October 2024, it just simply means that we are merging the two systems. So it won't be new arrivals versus City of Chicago homeless. All entities will be dubbed as homeless. So it won't be a separate line, okay? So that means it's going to be a lot of change happening. So that means that I will no longer be the new arrivals recruitment and, enrollment liaison. I'm like, how dare you change the title that I gave myself, right? They're real cute. I know. So I don't know what my new title is going to be. I'm gonna think about it, and I'm gonna let you guys know next meeting what my new self-proclaimed title is. But for now, I'll just remain the manager of program operations and quality, which is fine. So that just simply means that if there are any families, be it if they are from another country, another state, here in the city of Chicago, any family that is seeking assistance regarding homelessness, they just need to contact 311. I know it's hard to see on this particular slide, but these slides will be shared with you guys. There's a QR code there where if there's a family that needs some support, some families may not have a device to scan a QR code, but you can do it. So you guys can scan a QR code for them, and it will direct the family or direct you guys, if you want additional information, to the landing page for what is currently listed as new arrivals, but it will transition to the One System initiative. So the link is there, the QR code is there. Does anyone have any questions regarding what I just stated? Can we make it bigger? Probably not. I'm so sorry, but you are welcome. If you need to, I don't mind. Come on up here. Just get on up and come closer. I don't bite. I've had my shots. I'm vaccinated. We're not contagious up here, but if you need to come closer, please feel free. If you have any questions regarding this, if you don't get the slide deck or for whatever reason, you just don't see this information, again, you can go to the website. If you just go to Google and put in City of Chicago new arrivals, it will direct you to the landing page so you guys can get additional information. There are also additional resources found at this link. It talks through, how you can donate, what's the process, where parents or where a family, being held until they have a place in shelter. The entire process is spelled out for you on this website. But again, I'm here as an added resource if you need. Next slide, please. This is really tiny, and I apologize. Every meeting I apologize for it. And I was going to change it, right? But it's changing anyway, so I didn't change the format just yet. But I'm going to read it to you. So currently there are about 10 shelters that were designated for new arrival families. At one point, we had upwards of 16. We now currently have eight shelters that are still housing new arrival families. What you see in red are the shelters that are no longer open and operating. So I'm going to tell you what's not open first. Little Village Pulaski, 26 in Pulaski, no longer open. Halsted Shelter, 2241 South Halsted, no longer open. Lakeshore Hotel, 4900 B as in boy, South Lakeshore Drive, no longer open. Ogden Shelter, 344 North Ogden, no longer open. Okay. So those of you who were, recruiting at those shelters, those families have been relocated to the currently open shelters. AIC in Uptown, Hyde Park, South DuSable, 4900 A as in Apple, Lakeshore Drive. Inner Chicago on Ohio downtown. Midway is a new shelter, one of our newest shelters for new arrival families, 73rd and Cicero. They are open. MWRD North Park is still open. Northwestern is still open. Super 8 on Sheridan and Walnut on Walnut. They're still open, which means that there's still recruitment and enrollment opportunities available at these shelters. So if any of you are interested in recruiting at any of these shelters, I'm still your point of contact to get you on site. So this is just a breakdown. Again, this will be shared with all of you. A breakdown of where all 680 children are currently being housed. We have it broken down according to age group. What is not reflected here is the number of pregnant moms. We also have expectant families that are also housed in shelter, in which we can, again, if you have any home visiting or services that you'd like to help support with expectant families, we have that as an option too. Are there any questions regarding new arrivals, soon to be overall homeless families, City of Chicago? I have a question. If I were you, this is the question I would ask. Okay, so humor me. Okay, I have a question. I got to do the voice too, because it have to be a distinction. Okay, so just like that. I have a question. So what does that mean for the homeless families that were already in the city of Chicago, and you're telling me there are 8 shelters. So how many shelters existed for the homeless families in the city of Chicago? Great question, Alter Ego of Sheree. There were approximately 38 or so, less than 40 homeless shelters that are facilitated by DFSS. We have a homeless services division. We have a new arrivals division. Those two divisions will be merging, which means the work between those two divisions will also be merging. So it's quite possible that either these shelters may close, these families may be absorbed in the shelters that already existed. That's what I'm waiting to get clarity on, which means that there may be additional recruitment opportunities at the other shelters that are already open in, existence here in the city of Chicago. I don't have that information just yet, but I'm just letting you know that these are the conversations that are being had. Excellent question, Alter Ego. Thank you. I try. I promise there's nothing wrong with me. I'm like, this girl is working for us right there. She got 2 personalities. Is that what it is? Thank you, Marsal.
It's the cafe.
It's the coffee. That's what it is. It's good too. I was at the table just loading it up. Are there any other questions regarding new arrival families? Go ahead. Yes, so I do not have it on this slide. Her question was, out of the 680 children in shelter, how many of them are currently receiving services? There's a significant amount of them. They're not on this particular slide. But since you asked, I can gather that and we can talk through that just so we know what the end goal is. So it's quite possible that the last time I looked at the data, out of the 680, there are about 200 that really needed additional services, which is good, right? But we also know that it's parent choice, so even if we see currently there are 85 children 0 to 5 at AIC, and if our data shows that 80 of them have been enrolled, it doesn't mean we want the conversation to stop. There are a lot of things in play. Mom or dad may be getting jobs. They still want to talk about their childcare options. So we still want our presence there, even if the data shows that they are all enrolled, if that makes sense. But that's something that we can, talk through in terms of just having it on the agenda. Very good question. See, and she didn't have an alter ego. That was her. Thank you. Are there any other questions? Of these, I didn't include this here, but to date, we have enrolled, I think it was 795 children in early learning since last October of 2023. So that's great. Give yourselves a round of applause. You did that. That's just what I know of, right? I keep telling you guys that I know you're doing more, and not all of you are reporting those numbers to me, but I would highly encourage you, like, even if you know for sure, like, well, I'm already at NWRD. I didn't need you, Sheree. I went and did it on my own. Kudos. But I still need your numbers so that I can report on your behalf to those who are asking. The mayor's office asks all the time, where are we? Who's enrolling? What agency? So I'm name dropping you all the time in a good way. So just let me know when you guys are doing any new arrival recruitments, okay? Any other questions? Angel, who's in the back there, wave your hand, Angel. She said a lot of y'all didn't even sign in. Can you make sure you sign in before you leave us today? We just want to make sure we have an accurate head count, but Angel's on her way because she's up next. Thank you.
Good morning, team. So I am DFSS IEP employee. And so every time I come to a meeting, I always think about what can I take home. I live out in the hundreds. And so one of the things I need to go back to is the conversation that Sarita was having. I know you guys have parent meetings. And so a lot of times in those parent meetings, if you could just have a slide that says, what are your concerns? And let them express their concerns, you'll hear all the information that you need to address within your organization. I know in the hundreds, yeah, Project 2025 is out there, but my parents are reading Agenda 47. So I need to read that in order to know how to answer their questions. So I just thought I'd put that out there, because you may get a question about Agenda 47, which is your president's agenda. Clinics. Clinics where Craig harasses you, asks you
Yeah.
to come and help and partake in any issue you may have with getting your kid enrolled or funding attached. They started back up. He's actually visiting, we're actually going out after this meeting to a site. So just know that they're back. We have a list of people who have asked for help first, because they're in dire need. But then just know, come your updates, you will see available times where you can sign up. But I just wanted everybody to know that clinics are back. Federal budgets are in process. I need you to be on the lookout. So this is what I don't want to happen. I don't want finance to say the budget is due such and such date. And then you say, I need an extension 2 weeks after that date. I don't have that time. I don't have that luxury. When you get it, do it. That's all I need to say about that. All my federally funded agencies, I'm targeting you because you know that it's a requirement. But for your state funded agencies, you guys do some type of assessment every year, or you should be. Please note that last year, I'm missing 3, and they told me they didn't do it. Okay. This year, I need it from all of my federal agencies that I fund. It's a self-assessment. When is it due? Of course, I'm gonna give you the wrong date, because I want it before it's due. So I'm gonna say it's due in March. But don't listen to me. This is gonna make you go to that sales book that Diffus has created and see when the right date is. But I'm gonna say March, just so you know. Oh, I know. Our home visiting and doula have said, where's my attendance sheet? How do I track my information? I got you. November 21st, we will have a DFSS staff do a mini webinar. We're gonna send out a link. Yep, Mark's gonna send it out for me. Any of your home visiting staff, any of your staff that do doula, you need to be present for this presentation. And I know that policy council elections have taken place. We have one that will happen in 2 weeks. So I'm just putting that on your reminder. No, none. Oh, it happens next Tuesday. Okay. So I'm just putting that on for your agency? Mhm. No, for your agency. Because we need to have those documents so that when your budget comes in, I know exactly who I'm looking for signature purposes. And without it, you're gonna hold your budget up. We don't wanna do that. Well, I don't. So please make sure that happens and that takes place. Thanks.
Hi, it's me again. So as you know, in addition to being the manager of program operations and quality, I'm also the interim assistant director of quality. Isn't that cute? That's funny, right? Anyway, so we didn't have an EDPD meeting last month due to scheduling. There was a lot happening. So we didn't have an opportunity to recap what happened at our in-service event that took place September 30th through October 3rd. Thank you. How many of you attended the in-service event? Great. How many of you attended all 3 days? Ooh, great. We thank you for joining us. I just wanted to recap what happened, where we were. So this is just some overall data regarding overall attendance. So across all 4 days, we had 615 people in attendance. Each day, we were planning for upwards of maybe 300 each day. Day 1, we had 353. So, you know, if you saw me, I was running around just smiling, but I was twitching at the same time, like, can everybody eat? and everyone ate, so which is great. Okay, we had lots of schedules created in the Sketch app. How many of you guys use the Sketch app? Did you like it? Was it helpful? Look, I'm saying like Jackie up here, like, it was all right, you know. So for those it worked for, it was really good. For those that didn't, we had on-site, staff who were able to help you. So I'm hopeful that that went well. We are reading through, or I've read through literally every evaluation that we received. So I thank you for your feedback. A lot of you were saying that you were cold, and it was a little chilly. A lot of you said the food was really good, and I'm glad you felt that way. A lot of you enjoyed the lunchtime presenters. So we had Mr. Robert Marshall, who was a motivational speaker. If you haven't heard of him, he's really good. He had boxing gloves and everything. I'm like, what are you doing, sir? But it was really, inspirational. So we had an overall a great event. Again, this information will be shared with you guys. I just wanted to highlight and thank you guys for joining us during our in-service event. We're also already doing our planning for pre-service 2025. We're hopeful that it's going to happen in August of 2025. So additional information will be coming soon. Does anyone have any questions or comments regarding the in-service event? Okay. Yes, go ahead. Will it be at the same place? Because I'm quoting you verbatim, because it was kind of tight. It was tight. It was tight, and we are not planning to have it at the same location. So those of you who have joined us in previous years, we typically go to McCormick Place, and McCormick Place is rather large, right? But it has pros to it. There's parking, it's ample space and opportunity. Those of you who joined us this year, we were at Crown Plaza, which parking was available, but it was tight. So what we're trying to do is a happy medium. So a place that's not too large and a place that's not too small, but still accommodating for those who may need, assistance with walking long distances, things of that nature. So we're considering all of that. And believe me, a lot of you put that in the evaluations like, this is cool, but someone wrote that, this is cool, but, and I read it in that voice, like, who wrote this? They sound like me. But very good question. Are there any other questions related to the in-service recap? Okay, that's all that I have. I think, yep. Fiscal finance is next.
Good morning, everyone. Thank you, Sheree. Good morning. Sorry to slide in here just in time. My name is Sharon Davis. I am supervisor of accounting over at DFSS, over at finance, CST grants. So I came today to kind of go over the finance numbers. So basically, what we have today are the expenditure and finance for FY 24 programs. And so for what we have for a Head Start is at 73% expenditure rates, which basically means at this point, you have spent 73% of your grant, which ends November 30th for all of these grants. So you should be at least 90% at this point. You have Early Head Start, which is at 59%. CCP, which is at 54%, and your expansion, which is at 57%, all are below. And at this point, we should have at least 90% for each of these because your funds are ending November 30th. We do understand there was a bit of delay with getting some of your COLA budgets processed and approved. So we do understand that, we take that in consideration. So we are working with the Comptroller's Office as usual. I know you hear that a lot. We are working with the Comptroller's Office to get your budgets approved. And for those of you who had second budget revisions after your COLA, we're working on those to get approved as well, so that you can resume spending. Also for an overall comparison of FY 25 expenditure rates, you have ECBG and CCAP, which both run July through June of next year. And those should both be at about 30% at this point. We do know that there are some challenges with CCAP. ECBG is 14%, CCAP is at 8%. They both should be around 30% at this point, being at November. The next thing that we have is just some highlights. So basically at this point, your invoicing for FY 24 should be through October 31st at this point. And if you have a budget revision that you're still waiting for, please reach out to us. We're actually reaching out to the comptroller's office. I'm sorry, I'm not speaking into the mic like I should, and my voice is very muffled because I have a cold, so I do apologize. But if you have a budget revision and you're still waiting for it to be approved, please do make sure that you are patient with us. We are working with the comptroller's office to get those approved. And important reminders, January 31st is the cutoff for all invoices for 2024 expenditures. And that means any expenditures that you have included for January of 2024 all the way up until November 30th of 2024. So last year I know that our cutoff was like in February, but this year we do need to cut off sooner. The comptroller's office had a little issue with trying to reconcile their records before they submitted the report to the grantor. Next thing is, let's see, and all of those invoices will include any resubmissions. So if you had any cancellations, any rejections, any errors, any debit memos, any resubmissions that you would need to resubmit, all of those need to be resubmitted by January 31st. So we'll try to reiterate that information, all of our communication to you. FY 25 grant application feedback is in review from the funder. If you further information, documentation is requested from you, please respond by the communicated deadline. If we reach out to you and ask you for any information regarding your FY 25 funds, please do follow up with us as soon as possible so that we can make sure that we have those funds available for you in a timely fashion. Those funds start December 1st this year, and we do not want any delays. Your FY 25 notice of award should be distributed. We expect those to be distributed hopefully by next week. And so you can anticipate receiving letters, allocation sheets from the finance unit, hopefully by Monday. We were anticipating by tomorrow, but we're trying to update our budget form this year. We noticed you guys were having a little issue with revising your budget. So we're updating your budget form. And we do ask that you use the most current budget form as always, because there are important updates on the most current budget form. And so you should anticipate receiving our emails by Monday, and you should also anticipate receiving emails from the contracts unit sometime next week with your award letters. And those award letters and the allocation sheet should agree. And that way you have the information so that you can complete your budget form and return those. We're shooting for a date of November 22nd. If you get them back sooner, that's great. If you're out of the office during that holiday season, we understand. We're just trying to get a little earlier start this year. And so for childcare, please complete your child care CSD Care CCAP billing self-paced course by Tuesday of next week. Refer to your emails from the accountant Selena Ruan that you sent out on November 12th for instructions. That's very important that we do understand what issues that you guys are facing with the CSD cares. And the only way we'll know is if you try to complete that self-paced course. For PI, PFA, invoices through October 31st should be covered at this time, and your initial budgets. If you have not received them, please reach out to us immediately. I do have a little bit more of information regarding some budgets. There are some agencies that I do see listed that are of concern to me because we are not able to process your budget. I will call out some of these agency names, and just to give you a heads up, we'll email you. I won't hang around and waste your time, but I do need to make sure that Ada S. McKinley, Carol Robertson, we are working on your PO, so I won't call your name out. You will get an email from us. So Ada S. McKinley, Easter Seals, El Valor, Henry Booth House, Kids Above All, Metropolitan Family Services, Southeast Asia Center, Baby Academy, Salvation Army, and Trinity Resources Unlimited. Those agencies, you hear your name, you're going to get an email later on, not to alert you or anything, but do respond to your email. It's because we may be missing some documentation from you that's preventing your budget to get processed. Also, iSupplier. iSupplier had been updated a few months ago, so there have been trainings. We do encourage people to attend the trainings monthly. The next training will be on December the 10th at 1 o'clock. Try to make sure that you can attend that training. We do know that OBM is working on updated training materials, and they will have it updated on the web as soon as possible so that you can have for your records. Insurance, it is important that you update your insurance. Make sure that you visit MyCoy, update your insurance. And if you have expired insurance throughout your contract period, make sure that you're updating those as necessary, because that will hold up your contracts, your invoicing, and any payments. Keep your iSupplier contacts up to date. You may get emails from us, and that's because we keep a manual record of our contacts. However, in iSupplier, don't forget to update your contacts there as well. There'll be times where the controller's office may be holding your invoices because of different issues, and they're trying to reach out to you. But if they can't reach you because your email address is outdated, then they may end up having to cancel your invoices just because they weren't able to get in contact with you in a timely fashion. So just make sure that you're visiting iSupplier and keeping those contacts updated as well. Let's see. And make sure you're invoicing monthly. If you invoice monthly, that will reduce need for expediting approvals requests and missing deadlines. So if you invoice on a monthly basis and submit accurate invoices regularly, that will keep your expenditure rates regulated very well, and then also help you to eliminate deadlines. And so you can refer to the website for the iSupplier training and reference material. Also, your finance contacts. You'll have Laverne and Teresa. Right now we're still missing that one accountant, so we just have Laverne and Teresa on the federal and state side. So you'll have Laverne and Teresa for Head Start, Early Head Start, CCP expansion, corporate RTL, and PI PFA. And for childcare, you'll have Selena Roy. So if there are any questions, please do reach out to the finance team and let us know if you have any concerns at all. Are there any questions? Thank you, everyone.
All right, me again. I was so excited after I sat down. Thought I'd get back up and try to make friends again. And sometimes what we're talking about gets heavy, doesn't it? Anyway, Are there any last questions, comments, concerns from anybody that we can address really quickly for you? Anybody? All right, so there's that word that's gonna come out of my mouth. How dare I, cares? She said, yay. Boy, I just get such a rounding applause when we say that word, man. There's gonna be a day that we're gonna say it and everybody in here is just gonna go, "Yeah." Oh, we're not quite there yet. So I am engaging a vendor because I need to get to the bottom of your lack of enthusiasm around CARES. We have put together a data system that obviously you're struggling with. Anybody want to raise your hand? Is that true? Oh, now they want to be loud. And I understand that. I spend more hours than I should working with the vendor on this system that you're still struggling with. And so is my team, as well am I. So I'm enlisting a vendor and we're going to do some focus groups. Because I can say it over and over again, and I can talk about it over and over again, but I really need them, the vendor, to hear from you what your needs are. It doesn't help me to have a data system and you're living on spreadsheets. See, some of them are getting real vocal over here on this side of the room about the spreadsheets. I don't know if y'all can hear them, but I can. Everybody wants to get away from spreadsheets, including my staff and including those who fund us. Because what I have to constantly say to them is, I don't have a data system that you can connect directly to and get your data because we are still living in spreadsheets. And my staff have access to these sheets and the agencies have access to these sheets. And then we aggregate all of this data and they're like, you're still doing that? And we are. But it's a problem because it is so labor intensive for you and it is so labor intensive for us. So why the heck do we have a data system, right? So I got to get past this. I've got to get past this for multiple reasons. Number one, we can't live like this. But number two, I can't let this vendor go until we fix what we need to fix, right? And I told them we have some fixes that we have to make. But I don't want it just to be from my perspective because then he's fixing what I need on my side. I need your side fixed as well. And so I'm engaging with a vendor who's going to put together some focus groups. They're going to talk to agencies. They're going to talk to my staff. They're also going to talk to some of the funders about what they need from us as well. Because at the end of the day, it's not just me who needs the data system and it's not just you. And so what we will do from that information is we'll then work back with the vendor and say, this is what we've aggregated. This is the information. What are we going to do? How are we going to fix this? Because we can't go another year. Can you be any more vocal? Did you have COVID this morning? She's like, oh, no, we can't do that. And I am in total agreement with you. I have had to temper my tongue in many meetings about the CARES system because it is just insane to me that this has been, for all of you who have not been here the entire time, it's been 3 years. 3 long years of my life working on a data system that I can't go to my desk today and do everything that I need. Can't continue like this. We've got to fix it. But while I'm fixing it, I need people in it. Because you can't tell me what the problem is if you don't go in it. Your staff can't tell you what the issue is if they're not in it and trying it and then telling me where it's not working. So I need people in the system. On a weekly basis, I have to report to the commissioner how many people are using the system. Now, what she has not asked me is the names of your organizations yet. But she's asking me for numbers. Numbers aren't going up fast enough, Sarah. I agree. I wish I had a miracle ball. I'd, just, rub it and everything would be fine, but that's not the truth. We have a system that's not the most intuitive system. Anybody agree? Yes. Could you tell them this? Okay, not to agree with Sarah. It is not that easy to use, and it does not help you go from point A to point D the way we want a data system to be able to, and I recognize that. And so for that, I say, I'm sorry. We've been trying and we're still trying to get it to a point that it works for you and also for my staff on the other side. And we are simply, and I'm just being honest with you today, saying we are not there yet. So yes, we are still living in spreadsheets because we still have data reports. We have one that's due on the 1st for ISB. We have one that's due on the 7th for Head Start. And then I have another one on the 15th. That's an internal one that goes external. I can't not have my reports go out. So yes, we're going to continue to do what we're doing until we can get to a point where we are all going to have a party. Because I think we all will deserve one. When we say, look at this data system we got now, it's working, y'all. I don't know if we're going to get there because we have to believe, right? I hear you trying to help me over there, Josh. I believe there's going to be a day that I'm not going to say the word cares and get this from the audience. But I recognize I'm not there yet. So I am going to need your help as we get these focus groups set. I need people in them. I need people to talk in them, say what the issues are. I did have the vendor. We were at our very wonderful in-service and she was there and she sat beside me in one of the sessions. And we talked after. That's why we're going to do focus groups. Because she could hear some of the questions that people were asking and then some of the responses from the vendor. So we know we have some help and some work to do. So I am not saying to you that this is all on your staff. I am not standing here in front of you saying it is your staff that's not inputting in cares and it's all on you that we can't do our data. I would never say that to you, and I have not said that to anybody external from DFSS about why our data is still on spreadsheets. I take ownership and responsibility for it because I'm the deputy commissioner and it rests with me. And I say that, and I say that, and I say that, and I say that. I'm tired of saying that. But what I'm going to do is continue to make sure people understand this is not about you. This is about our data system. An honest retort about it. It is our data system. I know many of you have tried and tried. I know my staff have worked and tried. They've been at your agencies and worked and tried, and we still have glitches. But we've got to get beyond it to the point that we can't, right here, I could be sitting over there with my computer, push a button and answer your question about your data. Can't do that today, but I got to get there. And so, yes, spreadsheets for a little bit longer. We will do focus groups so that we can hear directly from you because you are the users of this system. So we can understand what is it on your side that's making this more difficult for you. And I know the one thing you can say, but it's not going to help me because we paid for it. You can't just go in there and go, just tell her she need a new system. I don't have the money to go do another one right now. We got to make this one work. Okay. So work with me by saying what is not working for you. What is the issue on your side? And I need you to be honest about this one thing. And I've said it, and I'm not asking you to say what I'm saying, but I'm just saying it. And if it's true for you, please repeat it. Okay. What I have said is this: you guys are busy folks. And if your staff trying to input a record and it takes them an hour, y'all ain't gonna do it. In agreement. So we are in agreement with you, but they need to hear it from you. Because again, we can put all these things together. And sometimes you put a system together thinking about a whole different group of folks going to use it. And that's some of this here. But what you do on your side, people don't have the time to sit there trying to get one record in when you may have 500 records you need to put in. I know, and I'll just use my two daughters as an example. If it took them that long, they would just walk away. I love my daughters, and I'd have to go get them and say, come back and try again. And they look at me and go, it don't work, Mom. Because I taught them to be honest, even if it's something that I wanted them to do. And I'm sure your staff are saying that to you. I need people to say what the glitch is on your side. If there's working, say what's working. What's not working, say what's not working. Say what you are not able to do if there are things you cannot do. Because I need to have a serious document that I go back to the vendor and say, this is what we need. Okay? That's the only way I'm gonna get it to a point that it works for you. So I'm asking for your help and I'm asking for your honesty. Okay? Any questions about that? Now, this one, they're gonna be really willing to go to, I think. You think? Yeah. Yes.
Like, yeah.
And we're gonna get there where you can only do it that. Thank you. I'm trying, but I need your help. And I'm just being honest here that I need your help. In order for me to put my finger on what the issues are, I got to hear from you and your staff. Because again, everybody is different, yes, but you're all trying to go in to do some of the same things. You're trying to enroll children, set up classrooms, you're trying to do attendance, you're trying to do your meal counts, you're trying to use the system. Something's not working. Okay, you had your hand up. You want to come up here with the mic? I invite you up front. Come on up, Ken.
Hey, good morning, everybody. We're helping to support the help desk right now with CARES. So part of that is we're starting to see some of the questions that are coming in or problems that folks are having. And also looking at the knowledge base that is there as far as the training videos and those type of things. And I think part of the disconnect with part of your staff is that there are things that you've got with the knowledge base that tells you how to do something. But I think the gap is that a lot of places people don't understand why to do it. And the why is sort of that bridge in between. I can tell you, this is a hammer. I can even tell you this is what a hammer does. But if I don't tell you where you need to use the hammer, then that becomes a problem. And I think that connection of the why, that when you get ready to do the focus groups, encourage your staff to talk about what process or policy pieces go along with the things to do in order to understand why they're doing it. Because I can be stuck all day, especially when I don't know intuitively why I need to do something to be in compliance, right? So I'll say, for example, we'll see tickets where folks will say, my kids are not showing up in my classroom. Then we'll look, maybe it's a week later, kids are showing up in the classroom, but there may be 3 or 4 weeks where no attendance has been taken, right? So if you don't have a program enrollment per se, you can't put the child in the classroom, you can't take attendance. Fair enough. So when we're talking about we're doing attendance on spreadsheets, folks who are sitting at the administrative level, as far as if you're a program director or anything along those lines, one of the questions to say to your staff as far as the way you manage things is to say, are all of our children they actually all have program enrollments? That's not always a question that everybody knows to ask. Part of the problem where program enrollments get missed is that unfortunately, everybody didn't do rollover the correct way. So there are about roughly 4,000 kids sitting right now that didn't have program enrollments. If you don't have a program enrollment, you're not going to be able to put a child in a class, a current program enrollment, and you're not going to be able to take attendance. But if you have access to CARES, you can look real quickly to say, I'm a program director. What do I want to look at? I just want to look at my classrooms. Are we taking attendance? And if not, then that starts part of that sort of root cause to figure out what happened. Not happened. Does that make sense to folks? So contextually, it's not just your staff going into CARES, looking at a training video, but them actually understanding why they're being asked to do what they need to do. And whenever there's a gap in the why, there's going to be a gap in the overall quality of the outcome. So I encourage you to, one, submit tickets, right? And everybody at your agency doesn't submit tickets. But when they do submit tickets, they should submit tickets with the name, CPS ID number, schoolman ID number, and date of birth for the children. If we get a ticket that says I can't enroll kids in the classroom, but I don't know which kids, it makes it harder for folks to be able to try to work on it, right? But that's one of those things that you want to just make sure the folks say that a ticket is not a place where you're saying the system doesn't work, but the ticket is where you're saying, this is my specific problem that I know of, and this is what I'm facing. Can you help me fix this? And the thing is that tickets, the way we're doing them right now, you have some agencies will send a ticket in for 2 kids. We have other agencies that'll send, I saw one the other day where they sent in a ticket for 100 kids. Took us a little bit longer to work to look at the 100 kids, but the avenue for you to be able to ask for help is the ticket system. But if you don't have someone in CARES who doesn't have access to CARES, guess what they can't do, unfortunately? Can't submit a ticket. So at least everybody at your agency, somebody needs to be able to have the ability to submit a ticket, and then they need to follow up on the ticket. But not to delve too far around that side, but just getting to the point of understanding the why of why you're being asked to do stuff and why you should do this in the system. I think that's one of the big gaps that we have right now. Folks don't have the contextual understanding about why they should be doing certain things. Does that make sense to folks? Yes or no? Yeah, okay. And I'm here for a second. If you got a question in the back, if somebody has a question, keep talking.
Hey, everyone, quick announcement. All
Thanks, Ken.
in-kind reports are due FY 24, as soon as you can get it to us, okay? All in-kind reports.
So for federal funded agencies, your in-kind reports are due. Thanks, Angel. Oh, when it comes to in-kind, that non-federal share, there is no waiver. We are post-COVID, and we are all required to do our non-federal share. And those in-kind reports are due because that is a part of our grant funding. You are required to have the non-federal share. And I know we've gone back and forth. Thanks for the reminder about tomorrow. And so if anybody has questions about what you can use and what you might be able to do with your in-kind, be in that community of practice tomorrow, because we cannot not show our in-kind on this grant that ends when? November 30th. You're going to have that turkey day or whatever you call it, and then it's done, right? And all reports will be due. So start working on them now so that you don't miss your deadline. So please get any questions on it. You can get answers from the question and from the gentleman in the corner over there. Ken, raise your hand again. But he's also going to do community of practice tomorrow, and he can be there to actually help your staff figure it out so that we can get these in-kind reports done. How many of you welcome parents back in your classroom to spend time volunteering? That's in kind. How many of you have anybody who's providing a service to you and they're charging you for some part of it? Talk to them about what? A portion of in kind, right? All those things that you're doing in kind. We're there, we're back, and that's what we have to do. All right. Any questions about that? Any questions about, yes? Do you work for me? You gonna ask me a question? No, I'm just messing with you. No, Anya, go ahead. Anya's question is the focus group going to be on the care side or schoolmen and cares? Right now, we're looking at the cares system because again, the application system sits on the outside of cares. where families enroll. That's part of what's going on with the ticket system is families did the application, it didn't roll over or it didn't come over. And so we've got some processes in place to make sure that those come over, but there's still like 4,000 kids sitting out there that are still not enrolled getting attendance because we haven't brought them back in. The other part of it, why I'm not really pushing the SchoolMint side, SchoolMint itself as the platform is going to go away and a new platform will launch April of 2025. And so we are going to limp along. I'm sorry, see, I'm not making any friends today, but I'm telling you where we are. CPS has moved away from the SchoolMint vendor and they are using a new vendor called BlenderBox. And so we are now working with them to align ourselves under BlenderBox so that it will align to our care system, et cetera, but it's going to go away. So right now, what we need to do is get all of the children that are not in your classrooms enrolled so that you can do all of that data. But we are going to have to do trainings and everything when we get to the BlenderBox platform. So it will be a different iteration, and that's what we're going to be doing next. And I'm sorry about that too. Yes, Ken. November 5th, there's going to, December 5th, December 5th, December, there will be a full training and it will be on non-federal match at 1 o'clock on December 5th. And that's what they're going to cover. What we've gotten back from our federal grantee is that we are post-COVID and there are no waivers and everybody's got to get themselves back into the mode of ensuring that you are documenting and providing information on your non-federal share. Okay, so that session will be there for you and there can be some TA given to you if you need some while you're here today. Yes, ma'am. Let me say that I got pushback. We've pushed back on some of those. And in some cases, we're okay, some cases we're not. But what we need to do is make sure everybody is doing it going forward. Okay, because they're not accepting any waivers going forward. Okay, they've questioned us on some of what we've even tried to waive as the recipient. Okay. So again, I just want to get everybody back in the mode of understanding that that non-federal match is a part of the grant. If you accept the grant, a portion of that is a responsibility of doing the non-federal match. Okay. So yes, I leveraged the BlenderBox and lost a couple of friends here. And, you know, Anya's like, you're going to talk to them about it. Well, not yet, because, you know, it's going to go away. But again, we need to work together. What Ken is saying, the ticketing system is there. If you're having some issues, being detailed in your ticket helps them help you so that they know exactly what it is. If they're trying to find children, if they're trying to move something for you, what is it? Just saying, I can't get to my children doesn't help. They're going to have to reach out to you to figure out what child, and then you're going to have to figure out what child ID number. So start there, pulling all your information together and then submitting your ticket so that they can really be your help agent on the other side. We need to move those 4,000 children. They should not just be sitting in the aura out there waiting on us to pull them in, because if they're there, they may be on your spreadsheets, but they're not in the data system. Hence, we can't use the data system. And that's why we got to get beyond this, okay? Because I know there are more children being served than I can see in CARES. And I can see that by looking at the wonderful, and I thank you every day for those. And she's sitting there looking, don't you say them spreadsheets. Those spreadsheets helps us keep up with who's actually enrolled and being served. So we know that there's a big gap there. Anything else? Any other questions, concerns from anybody? So we won't see you before the next holiday that comes up in just about a week or so, something like that. I don't know, I've lost track. But I'm hoping everyone will be able to take some time for themselves, spend time with your families, enjoy yourself, get some rest, so we can come back and do it yet again. So thanks, everyone. Stay safe and be well.